Maybe. Hey, there they come. Thank you, Tammy. We'll begin with prayer. Heavenly Father, we come before you today grateful and thankful for the opportunity that we have continued to serve Montgomery County and to serve your community, that we get to model the values that you teach us in the gospel and to bring the gospel values to life through our own lives, through the way that we interact with those that we meet, the way that we treat those that we interact with, and the way that we love everyone. We continue to ask for the courage that it takes to treat all humans with dignity, and that we are challenged and meet that challenge every day behind this bench to do what is right for your people and to do what is right for the community that is Montgomery County. We pray for the courage and the strength to do that, and we thank you for the wisdom that we use to discern those challenges. As we pray today in your holy son's name, amen.
Amen. Hey, Kendall, before we get started, Wade, you want to come up and give us an EMA report? That way you don't have to, you can get back to work. I know y'all got a lot going on, so.
I got to stay anyway. I don't know where he is. Cody's got something for me today.
Oh, okay.
Good morning, everybody.
Good morning. Good morning, Wade.
Not a lot going on at the current moment. You know, it's been cold, really cold. It's going to continue to be cold. We'll warm up a little bit later this week, just for a couple of days, and then the National Weather Service has been sending out several emails over the weekend for potential threat of winter storm next weekend, hitting Sunday, Monday time frame. As of now, they're not expecting massive snow like we had in January of last year, but they are expecting it to be a wintry, watery and icy road conditions as of now. Montgomery's right on the threshold of the cutoff line. Most of it is just north of Montgomery and above, but they were, this time last week, they projected to snow in Montgomery, and as we got closer to the date, it slowly the snow moves further and further south. So still too early to tell. We got a meeting today with the state and the National Weather Service to discuss potential more details, but you know, as anything comes out, we'll send it out through social media and through our other outlets and media and stuff like that. But
I know a couple of school leaders that will be burning your phone up come towards the end of the week.
yeah, they did it last week too.
Did they?
So yeah, it's all good. Luckily, in today's day and age technology, you don't pay for by the minutes anymore with Verizon. You pay unlimited data, so you can call them all you want to. That's all I got, sir.
Make sure your mic's on. Yeah, so we got a proclamation, I guess, at
Test,
10 o'clock.
There you go.
Proclamation at 10 o'clock.
Yes, sir.
Yes, sir. All right, thank y'all.
All right, ladies and gentlemen, Regina Walker, our deputy administrator, is going to run today's meeting.
Good morning and thank you.
Good morning.
Our scheduled attendees for today is County Engineer George Speak, followed by President Mitch Henry with Faulkner University. Under our new business is considered the sale of 3 decommissioned vehicles. Montgomery County Sheriff's Office and Chief Richardson is here. Consider subrecipient agreement between AUM for the State Crisis Intervention Program grant. Item number 5, consider amendment number 1 to Galls LLC to extend the contract until March 17th, 2027, Sheriff's Office. Consider amendment number 1 to Galls LLC, extend the contract until February 3rd, 2027, Montgomery County Sheriff's Office. Consider a change order for a new UPS system for the Montgomery County Detention Facility. Consider 2026 county employee blood drives, Montgomery County Commission. Consider miscellaneous appropriations. Are there any additions to appropriations to agencies?
Teresa, I had sent one. Did you get that one yesterday? You may not have gotten it. If you, we can just put it on the next, we can do it 2 weeks from now.
Yes.
Anybody else? Commissioner Sankey?
Thank you. 2,500 from agency to the bonds program or neighborhood services, City of Montgomery.
Is that for a particular neighborhood?
No, it's for actually for.
4 bonds.
Yes.
Yes, sir.
Thank you.
Any other additions to agencies? Okay. Consider miscellaneous appropriations to education. Are there any additions to education? I'm sorry, Commissioner Harris, are you on? Okay. He's on? Okay. I just wanted to make sure he wasn't trying to talk and I missed him. Thank you, Rodney.
Yes, I'm here. Good morning.
Did you have any additions to agencies or education at this time?
No, I think it's all on there already.
Okay.
Excuse me, I'm sorry. Could you, I want to modify that.
Yes, sir.
From 2,500 to 2,000, please.
I wrote in pencil, so I got you.
Thank you.
Consider miscellaneous appropriations to designated revenue. Are there any additions to designated revenue? Okay. Consider travel training requests for finance, sheriff, and tax and audit. We do have two proclamations today. One is for, in honor of the life and legacy of Ms. Claudette Colvin, and the other one is from Mr. Wade Lau with EMA. First guest, George, speak. George, you have three, so prepare to stay put.
Okay, it's that item number one here, that's just a resolution for the authorized resurfacing Butler Mill Road. It's an MPO project, 80% federal funds, 20%.
Gas tax.
Yes, sir, and it'll be a 27 project, so we'll budget the match in next year's budget.
Any questions, Carmen? That's yours. Next agenda.
And same thing on item number two, resurfacing Gibson Goodwyn Road, and this MPO project, 80-20 match on it, 2027 project.
That'll be next agenda.
And item three, that's the phase 1 and 2 of the walking trail at Elton Dean Park. And the low bidder was McDonald Construction at $233,804. And it's 80-20 match on it. The match will be around $46,000.
Yes, sir.
I just have a question about that, George. I was looking at the two bids, and it seems like Jackson Civil Construction was kind of way out of line compared to McDonald's. Did they understand what they were bidding on?
Yes, sir, the engineer, the consulting engineer that we had, he's reviewed it, and he recommended awarding it to, it's got their estimate, which their estimate was higher than.
It was way high, so I was just wondering if they even had an idea, not to suggest that they didn't, but it was just, I'm just curious about the vast difference between some of the unit prices for those items that McDonald quoted versus Jackson Civil Engineers. So I was just curious as to whether or not they really understood what they were bidding on, because there was a significant difference in the price.
Yeah, yes, that's a good price they gave, that they bid on it.
Yeah, that's the biggest thing was mobilization. They were.
Yeah, I was going to ask you, what is mobilization? Is that,
It's just moving the equipment and everything out there.
so they must be coming from a long way, because everything that they have to transport is triple, yeah.
What's not, Jackson, I think I know them.
But even their crushed aggregate, I mean, they were
Is that,
about
I think I know
300% higher than the other two.
I think I know that I think that's a minority-owned company, if I'm not mistaken.
So the McDonald Construction Company
They did some work at Whitewater, I believe.
are they a local company?
Yes, sir, they've been around, what,
Okay, good.
yeah, if they, we'll have a bond and everything on it if they default. We've got a bond that goes with the contract.
And that column for engineering estimates, that's what you all did?
That's what our consultant did, Croy Engineering, he's the consultant on it. That was their estimate. Their estimate was 452, and,
No,
There's was 380.
oh, excuse me, yeah,
Right.
yeah, 382, excuse me.
and they came in at 233. I hope they can do the job.
Yeah, it's like I say, it's, sometimes it's, you don't know, these bids, you just don't know how they'll turn out, but we will have a bond on it, guaranteeing the completion.
So what's your question? The other company, did you give them, allowance for being local? Is the other company local? The one that won?
McDonald's is, yeah.
Okay. So is, yeah, that is the Jackson. I do, that young man did plenty of work for us on Whitewater. So,
That's right.
Danny Jackson, yeah, his company, construction company, one of the minority construction companies I worked with on Whitewater. So, and won the bid with that, so, okay.
I've just another question. Why do we need a consulting company
That's gonna be my next one.
to help us with
Yes.
these bids? I don't understand it.
It's just getting the plans and all together, just more, we don't have the staff to do it. Yeah, you want to comment on that, Kevin?
Yeah.
This one's a little bit beyond our expertise and what we do every day. It's a lot more surveying involved and a lot of ADA compliance measures that had to be met. So, we received a grant, so all we really had to pay was 20% of what the consultant does in regards to the plans. So, a lot of it is paid for via federal government.
I just think to me that it ought to be the engineers, whoever, well, your department might do some of this work, and it seems like whoever is bidding on it ought to be the ones who meet the criteria of satisfy whatever we need to get the project moving. It seems like it ought to be the folks who won the bid, as opposed to having an additional expense for consultants.
You can't use the contractor with grant money, the one that gives
Oh,
you the
that's the
information can't be, yes, sir. You can't use the one that helps you write the grant application and prepare the information to then do the work.
Jail up here, thank you. I almost did that.
Well, no, it's good to get some clarification on that.
It is, and that,
Yeah.
and I learned that too. CROI helped us prepare the application, so therefore they can't bid on the project.
Do we need someone to help us prepare the application?
Yes,
That's
sir.
my question.
I don't speak engineerese,
Okay,
so, yes, sir.
okay.
But
All right, thank you.
to kind of answer your question, could we have done everything? Yes, I think we could have done, other than some of the surveying, we still would have had to farm out. But did we have the time and manpower to be able to do it? No, not with everything else we have going on. As you know, most of our engineering services are geared toward resurfacing. So as we get on these additional projects like TAP grants and other types of grants, we need assistance. Otherwise, we'd have to build our staff up larger than what it is.
Thank you. I was just curious, because it's just a road, with whatever it requires, so.
Yeah,
thank
we're
you.
really good at getting asphalt put down and resurfacing. Our staff is geared toward that, and anything beyond that we can do, but it's rearranging resources to get that done.
Is this walking trail surrounding the pond, is that what we're talking about doing? Or is it
Correct.
different? And the whole walking trail would just be around the pond, nothing else?
Correct, on this phase 1 and phase 2. And again, this is a TAP grant, so we're utilizing federal funds to do this.
And what do they charge us for those services, the engineering services?
I have to look. Do you know off the top of your head? One second. It's in the bid. Typically, it runs around 15% of the total construction cost, but I don't have the exact number.
Okay. All right,
Yeah.
thank you all. All right, appreciate it. Thank you, Mr. Chairman.
That'll be next agenda. Thank you, George.
Okay, thank you.
Consider resolution approving the 2026 back-to-school sales tax holiday for July 17th through the 19th, 2026.
That'll be next agenda.
Consider agreement with Jackson Hospital to ensure continuity of healthcare services.
Question about that. I didn't see a signature block for the folks who represent Jackson Hospital in terms of them consenting to the criteria that we've established to get the funding from the taxpayers.
We will
Connie
make
was gonna
sure.
speak on that. I'm
Yeah,
sorry.
we can make sure we get that added. There are gonna be some changes, any and all changes that are gonna be made will be, because Connie and I talked about something else that needs to be altered. as well as when the city has the same agreement, but I think I spoke with the city, they're gonna make some changes, but we are going to ensure that both versions of this contract, city and county, are identical. Because we want to make sure that we both have the same understanding and that Jackson understands that we are united in our effort to proceed with this project, but we all have the same language that we're speaking. So, yes, sir.
And we'll see any modifications, we'll see them.
You will see them as we get them.
All right.
Yes, sir.
Thank you, sir.
No problem.
Let me say this, when I prepared this, I envisioned, and it says in this contract that Jackson would enter into a separate agreement, which would have to be approved by the bankruptcy court, of course, but we can certainly make them a signatory to this agreement, but it will require some revision, but that can be done too.
I want to make sure that they're not including anything. I know we had a date of November 2025, and they're still, incurring expenses through bankruptcy proceedings. Want to make sure that none of those things are added or included in the money that we
Right,
give
and
them.
that part that you just mentioned has actually been ordered by the bankruptcy court. They can't do that.
Okay.
That's an order, but it's in our agreement as well.
All right. Thank you.
I was, Carmen, and Isaiah, y'all were in the meetings, a couple of meetings with them, was to discuss on the 7.5 million, how that would be paid over which years it would be paid. Was any discussion at all with that?
No, it wasn't. We had not gotten to that point
point,
to talk
okay.
about that yet. We were still trying to work out the details and have a discussion, but I'm gonna get with Commissioner Sankey and go ahead and reschedule a meeting probably for, if not later this month, 1st of February, Commissioner Sankey.
Yes,
So we
ma'am.
can do a follow-up.
With our
with the-
neighbors in the
Yes,
river region?
That's it, and our city, county, city council and some other, and President Ross and all those, invite them back to the meeting so we can get some follow-up and some understanding.
Okay, we definitely need to make sure we get our neighbors in Elmore and Otago
Oh, yeah,
County.
we're gonna invite them to the big meeting too. We're gonna have a
Okay.
shindig.
All right, thank you.
So that will be next agenda, Regina.
Yes, sir. General information items are the next two. Number 6, discuss board member appointment to the 2026-27 Montgomery County Recreation Board. On your attachment, you can see that Mr., I'm sorry, I can't pronounce the first name, Williams Long, term expired last month.
Who appointed him?
That was, I think it's a female. What's,
Oh, her.
that's,
You
Oh, I'm
appointed
sorry.
her?
yes.
Okay.
And we have another recommendation, Miss.
Billy Taylor?
Yeah.
What's the name
Outstanding.
you recommend?
Billy, Billie Taylor, Miss Billy Taylor.
Okay.
Are you good with that, Isaiah?
Yes, her name should have been on there.
I mean, next agenda, it's on there.
Okay.
It's on, yeah, Mrs. Billy Taylor, James Williams has recommended it.
Okay.
So that'll be next agenda.
I'm sorry, I should have read the memo. My apologies. Number 7, discuss board member appointments to the 2028-29 Community Punishment and Corrections Authority.
Dan, Damon is on here. Is he okay to stay on the board?
Yeah,
Okay. And
the only one that I wouldn't reappoint is,
Evan Magoo?
McCullough. McCullough.
Dixon.
Yeah,
Yvonne, she's a female.
Dixon.
Yvonne
No,
McCullough.
no, Dixon.
Okay.
Okay. Who's her appointment? Who appointed her?
I don't show that on here. Her term
know.
expired
Must be Dan- must be
12/1/2025.
If you don't know, if none of them claim, it must be Dean that appointed her, because he wouldn't be able to claim and tell you. So
Okay.
it must have been him. Did she want to stay back on? Does anybody know her?
I do not know her.
We can give me the information, I'll reach back out to her, see if she wants to stay on.
So we will make this the next agenda pending Commissioner Moore Ziegler reaches out and confirms. But Damon Harris will be on the next agenda for sure.
Okay.
Damon's done a good job on that board.
And that's all we have,
Except for,
the resolution.
Nope. You got scheduled attendees. You got one more.
Oh, I'm sorry. Mr. Mitch Henry with Faulkner University. My apologies.
And as Mitch comes up, Mitch invited me out to Faulkner last week, a week or so, maybe a week before that, and just shared with me some information about some new exciting things that Faulkner has coming. And Commissioner Costanza, have you been out there?
Many times. Incredibly impressive and excited to hear,
So-
for everybody to get to hear from Mitch today.
Yeah, I wanted all the commissioners and the general public to kind of hear what Mitch has on the horizon for Faulkner University and what a difference it's going to make in Montgomery.
There we go. Well, thank you, everyone, for the opportunity to be with you here today. I've lived here forever. I was born in what is now the Alabama Law Enforcement Agency Hospital, and I appreciate so much the opportunity to speak to you today. I practiced law for almost 30 years here, and God,
Get close to that little
yes, sir,
mic.
God's got a sense of humor to make a lawyer the president of a private Christian university, I believe. So I'm so thankful to be here. Going on my 4th year at Faulkner, I taught at the law school there for a little while, and they asked me to apply to be president. I want to share with you why the president of a private school will be standing before the county commission here today. You may be wondering. First of all, we want you to know what's happening at Faulkner University, but second of all, I want you to know that we want to partner with the Montgomery County Commission. We try to help every student make their career a ministry to serve others. And I want to share with you what we're doing to impact the community. We want to impact, and we are impacting the community with regard to health care. We're impacting the community with regard to education, law, and prosperity with our businesses. So I want to concentrate on health care. That's what's on our minds so much in this community, with the issues regarding Jackson Hospital, the issues regarding the lack of services for special needs children and adults in this area. One of my paralegals moved to Birmingham when her newborn was diagnosed with a neurodivergent issue because we didn't have the services that we're involved now at Faulkner University in helping to produce. Healthcare education through service. We're a leader in that, and we're committed to that. How do we do that? How do we serve our community? Well, we're serving our community through private and public service partnerships. And that is where the commission comes in. We already partner with these specific state agencies to provide services to children and adults and others with special needs. That's rehab services, mental health, human resources, Department of Education, Veterans Affairs, and the Department of Public Health. And that's not everyone. We provide health care services in 4 specific areas, some that are under development, but some that are very developed and have already begun impacting this community in substantial ways. The first is the Center for Therapy and Research. We provide free therapy. The PATH Partnership provides free training to healthcare workers. The CTI, which is under development, will provide special ed and therapy for children from the time they're born until they reach adulthood and become productive citizens in our community. And then another deal under construction is Eagle Care, which is a mobile clinic that will impact the community. I want to talk about the Center for Therapy and Research. If you've been out to our campus, you can take a tour of the therapy center as well as our College of Health Sciences. Since it opened, we've provided, and we will provide and celebrate by the end of this month, 50,000 free therapy visits for children and adults with special needs and other needs. We're seeing 75 clients every day in this community. And these are for all ages. We focus on autism and neurodivergent disorders, but also stroke victims, traumatic brain injury folks. And we also are pleased to announce the grand opening of the Faulkner Mental Health Center for veterans. They'll receive counseling service. It'll be extended to all veterans and their families, because often it takes family members who need support and counseling as well. And you're invited. We've got a ceremony. Please mark your calendars for March the 6th, 2026 at 10:30 a.m. A lot of veterans have traumatic brain injuries that often lead to post-traumatic stress disorder, and we're wanting to step in and supplement the services that are already there, but not supplant what's already being done by great providers in our community, including the Department of Veterans Affairs. So how do we serve? In our Center for Therapy and Research, speech-language pathology, physical therapy, occupational therapy, and licensed clinical mental health counseling therapy. And again, that's not just for the patients that have the need for the other therapies. It's for the entire family. As you know, autism is increasing in an epidemic way in this community, and being able to counsel parents and even siblings, grandparents and uncles and aunts to help with these children and adults is critical. So what do we still need? We want to add exercise and recreation therapy. Exercise and recreation therapy. And we see this as an opportunity to partner with the Montgomery County Commission, and not just the Montgomery County Commission. We're here first because most of the children and adults that we see in our clinic are citizens of Montgomery County. But we'll partner with all the folks in the surrounding communities and with the city if they're willing to partner with us to help provide free exercise and recreational therapy in a supervised way for folks. We already have clinic spaces where we do some exercise and sports and recreational therapy, but they're not large enough for us to do and meet the needs in the community. So we have begun planning, and we've already received a major contribution from a local family to build the therapeutic recreation inclusive playground and pathway. If you've been out to what used to be the Burlington Coat Factory, next to it, years ago, it was the home quarters, and there's 40,000 square feet of flat concrete that used to be the garden center. We're going to convert that into a state-of-the-art inclusive playground and Miracle League Field Recreation Center that will be supervised by our clinical faculty, by our staff, and by our college faculty, and it will be staffed by our students who are learning just like we do in the Center for Therapy and Research. Those 50,000 free clinical visits already that we've done in this community have been done not just by clinical faculty, but mostly by our students that are learning and getting those degrees. So our students that are getting exercise science degrees will be able to help. And in addition to the playground itself, there will be a pathway that goes through our campus past the Gene Stallings and John Mark Stallings statue that's outside our stadium. Did you know that Faulkner University's stadium, the field itself is named after John Mark Stallings? That is the only athletic field, collegiate or pro, named after a special needs adult in this country. We're committed to health care for this community. Now I want to share with you a video that was put together by the group that helped us put together this plan. And as you see, when you enter there to the right, that's the existing clinic where those yellow dots are on the wall. As you enter here, what we have under development is a state-of-the-art way for people with special needs to connect and get the exercise and the recreation that they need for an abundant quality of life that we're so committed to. This equipment is expensive. It is specially made to protect and promote the health of special need children and adults. These children are going to be received into this facility in a couple of ways. First, they'll come from our existing clinic. They'll be able to get recreational therapy through the referrals from the Department of Mental Health, the Department of Rehab Services, but we also want to open up this space to the public for those members of Montgomery counties, those citizens who have children or adults with special needs, so that they can get the services that they need. Now, we'll be able to check folks in during some public hours that we would agree upon with you and other public entities that hopefully will support us. And during that check-in time, we'll certify that they do have a special need and that they are related and that they are citizens of Montgomery County. Why do we want to do that? Well, we don't want to lose the warranties on this equipment. People who use the equipment that are adults, for example, if it's a child special needs piece of equipment, we could lose the warranty on it. But more importantly, we want first come, first service to be for those young people and adults that have special needs, so that they can be supervised and taken care of during those public hours. It would be a few hours during the week, it would be a lot of hours on Saturday, and it would be Sunday afternoons. You'll see the field there. The field, already you have the county commission supporting a Miracle League field out in the Ray Thorington area. This field would be a padded field for soccer, for kickball, and it could be converted also to play baseball or other sports in an appropriate way where these children could compete in a safe fashion and format. So we would love for you to consider that. We're happy to share our budget on that with you at some point. And by the way, we're not looking for any dollars this year. You've already done your budget. And this would be next year. We're continuing to raise funds for this project from private means, as well as we'll be communicating with other entities. We would love for you to consider partnering with us on other services besides our therapy clinic and the trip. I want to share with you something that's truly remarkable and state-of-the-art and does not exist anywhere that I know of. Partnering in Alabama for training and health care. Stay tuned. Within the next few weeks, we'll announce a partnership with a private entity, one of our great community partners, very large partner that employs a lot of people in this part of the world, is going to partner with us to help fund the PATH partnership on an annual basis. Already, Baptist Hospital is partnering with us, East Alabama, Troy Regional Medical Center, the Alabama Department of Public Health. There are a few that are not on here. We've just entered into a partnership with the Alabama Department of Education. A week before last, there were 51 public school nurses on our campus getting state-of-the-art training on the best simulation equipment in the world. What I'm talking about here is medical avatars, okay? So they speak. They allow those who are getting the training to inject, they can code, they can experience pain. One of the child mannequins sheds tears and cries. We have a medical mannequin that gives birth to a baby mannequin, okay? And all of that, I'm telling you, it is the best state-of-the-art equipment in the world, supported by grant funding from the Alabama Department of Public Health and private funds as well. And with that, we're building a simulation center. Now, this should connect very well with the county commission, because we're building it where the probate court extension used to be. And so I feel terrible for kicking my friend J.C. Love out of the probate office, but what we're replacing it with is an expansion of our existing small simulation center so that we can accommodate large groups. Our plan is to give this training to every single public school nurse and EMT in the state of Alabama. Our plan is to give free training to every single public health nurse, physician, medical provider of any kind in this facility, which will be right in the middle of our College of Health Sciences and our School of Nursing. Cradle through Independence, this is under development. Imagine combining all of this healthcare therapy with special education. and allowing families in this community that are tempted, just like Ashley Collins, my paralegal, to want to move out and move away and take their talents and all their connections with them to another larger city. Imagine them staying here, because from the time their child is born that has special needs until they reach age 21 to 25, when they're ready to go into the workforce, they get all of the maximum amount of therapy and educational training that they need to do the most that they can do and be the best that they can be. That's what we're planning at Faulkner University. And then finally, Eagle Care. We want to take what we're doing in our clinic mobile. There's some areas of even Montgomery County, but also the surrounding counties and places in the state that don't have the therapy they need. There are thousands of folks in rural areas of this state that don't get the services that they need. And our plan is to take our clinics and our training mobile. And we'll utilize our nurses that we're training, and we'll utilize our physician's assistants. Very similar to a nurse practitioner, these students will be a part of the mobile clinics. And folks, we have other plans because we're attracting and we're bringing folks to work with us who are truly the best in the field at what they do. And I brought a few with me. First of all, Charlie Robinson. Would you please stand, Dr. Robinson? She is my new right hand. Dr. Robinson is a retired school principal. You may have signed her paycheck, I don't know, through the years. And it took a retired principal to get me straight and focused on the major projects that we have at our university. Next to her is Dr. Cassie Boyd. She is the dean of our College of Healthcare, and just an amazing person. Pharmacist, taught pharmacology at our College of Health Sciences, and very quickly we realized her talent and promoted her to be the dean. And she's the mind behind the PATH partnership that is launched and taking off and doing so well. Next to her is David Woodison. David comes to us from Auburn University. He managed the recreational and exercise fitness centers there at Auburn University. If you've been to Auburn, you know it's one of the best in the country, and we're fortunate to have him with us. The Therapeutic Recreation Inclusive Playground and Pathway, Brother David is going to be extremely important in leadership with regard to that launch when it occurs. Next to him is Alan Deal. Alan Deal is a Montgomery native. When he's not hunting, he's taking care of special needs children and adults. We were able to lure Alan back from Birmingham, Alabama, where he managed a regional occupational therapy and physical therapy conglomerate, multiple locations all over the southeastern United States. And we're able to bring him home because he believes in the mission of the Center for Therapy and Research. He has a heart for special needs children, adults, and for veterans. And it was his leadership that helped us secure a grant to build the Veterans Clinic for Mental Health Counseling. We've got some of the best folks in the world. Next to Alan is Sarah Housley. Sarah Housley is an educator and an amazing person with regard to special needs. She has served as the head of school for a lower division school here in Montgomery and has done amazing work. She has the bandwidth to launch Cradle Through Independence, and we were able to lure her away from a wonderful job and experience where she was to launch Cradle Through Independence. And then next to her is our grant coordinator for the university, Elizabeth Hales. Her dad was Air Force, taught at the War College, and Elizabeth and I have grown up together. She became my paralegal in my first law firm and then stuck with me, and I stole her from my law firm to come work for the university, and they're still pretty salty about it. So, folks, we are building the best facility inside and out for health care, not just in this area, not just in this state. Our intent is for all of these programs to meet people's need with leadership and health care through service in a way that is literally the best in the world. And we're committed to that. We're committed to being fiscally responsible, and we want to partner with our community. You've been so good to us in so many ways. We appreciate the work that you do. Listen to Brother speak, talk about what happens on the roads. I live out in the country, and I appreciate what you do out there so much for us in so many ways. Thank you for the time that you've been able to listen to me this morning. Thank you for your commitment to the citizens of Montgomery. God bless you for the good work that you do, and we hope to be in touch here soon.
Mitch, you mind taking a couple of questions?
Yes, sir. Do you have questions for me?
Regarding the veteran services,
Yes, sir.
Dr. Henry, how do you avail yourself for the veterans who are listening, myself included? How do the veterans avail themselves of the services, the mental health services? Do we go through the VA for referral, or can we just walk up to your door and get those?
Yes, sir. It is an open referral. I'll let Brother Alan Deal speak to that. Would you stand up, please, Alan? And if you'll come over to the microphone, that'd be great. So, very good question.
So yes, sir. So currently, we already provide mental health services through licensed professional counselors to individuals with special needs and their families. So the veterans themselves, the mental health services don't require referral like our occupational physical therapy, speech therapy services do. So they can reach out to us directly. We'll also have information on our website, which is faulknerclinic.org. We're currently in the process of expanding that. But we are working with several different private agencies. We have several veteran students on campus as well, but they can just reach out to us directly to set up an appointment to meet with our new retired Army Colonel James Crocker is our new counselor. So we thought if we're serving veterans, we want to have a veteran on staff that can relate and help process anything that they need to go through. So, but yeah, they can reach out to us directly to set up an appointment. It's simple as that.
Thank you.
Yes, sir.
Thank you. Hang on up here. You might have another technical question.
Mitch,
Yes, sir.
you know, you got my heart when you talk about veterans and special needs. I was just, had a meeting last week, and a grandmother says, you know, that she has a grandchild with Downs, and that they're looking to move out of town. And I said, wait a minute, I just met with Mitch last week. And so I got Mitch hooked up with her through the phone. So hopefully they will consider staying here. But we have so many. I know doing the Miracle League out at Ray Thornton, I've had so many of my families out there have relocated because we really didn't have the programs here in Montgomery like they can get in other bigger cities. So I'm just really, really thrilled that people have this opportunity. And I wasn't aware of it until you invited me out, so really just wanted to kind of have you an opportunity to spread that word and let everybody know what's going on, because this is so critical, especially for these special needs families, to have a wraparound program from the time they're born until the time they can go out into the workforce. They can come to Faulkner, you know, it's a one-stop shop, get their education, all the schooling they need, all the physical therapy, occupational therapy, everything like that. So I applaud y'all for what you're doing. Nobody really knows what you're doing out there. So thank y'all for coming and sharing that with you. You had mentioned a lot of free services. How are y'all paying for those services? Are through grants now?
So multiple ways. We receive grants from a number of the state agencies that I shared with you. Some of those grants come to us directly. Some of them flow through a pass-through entity. We have a fee-for-service arrangement with the Department of Mental Health. Interestingly, our new autism coordinator for the state of Alabama is a Faulkner graduate.
Dr. Chelsea Taylor, she works for the Alabama Department of Mental Health. She was with DHR formerly as a social worker, but she's also a licensed professional counselor. So.
And so theirs is through referrals, and then we send them based on the actual services that are provided, and there are different fees for different services that are provided. Alabama Department of Rehab Services provides a grant, and we provide the number and nature of folks to them. The grant for Veterans Affairs was a grant for build out. We matched that grant with private contributions and dollars to build the clinic. And then we have private individuals that give consistently. Some things come through legislative funding. The training is geared around a fee for services. But again, we give a flat fee and we provide free services to folks. So it's a blessing in the clinic for children and adults with special needs, because often what you find is insurance therapy coverage runs out, even if you have insurance. A lot of our folks are Medicaid. A lot of our folks don't have insurance at all. And so we're meeting some critical needs that otherwise would be burdens on our hospitals and our other service and medical providers in the community. So again, we want to supplement and not supplant what our good physical therapists and occupational therapists and speech therapists are already doing in the community. And we do that by taking on the load of those that often may not get priority in a private clinic. They'll get to come to us and we'll look out for them. And if they need more therapy than what their insurance would cover, or what Medicaid can do for them, then we provide that until they get the full benefit of the therapy they need. Is that fair?
That's absolutely correct.
He could have told you all that. So.
Well, I just want to say thank you, Mitch, for coming out, for your entire leadership team. You know, Mitch, I've told everybody, one of the things that Faulkner does best with you at its lead is hire good folks. You have surrounded yourself with an incredible team. I'm proud for Faulkner to be right in the heart of Montgomery County District 3, and it's a real gem. And if folks have not been on campus or to see not just what is happening at the College of Health Sciences, because obviously that's new, that's flashy. Y'all kicked us out of our building, and I've never been happier about it, right? It was a joyous eviction, because what's coming is incredible for our community. And so often, this bench has to determine how we use our time, our talent, our resources of the county to benefit the community and the citizens that we serve. And you're 5 years ahead of us. So much of what we do, we come in, it's almost too late. We're trying to Band-Aid. We're trying to figure out how do we fix a major issue. Well, what Faulkner has done in all these ways, 50,000 free clinic visits, is incredible. And never once have they stood in front of us and asked for a dime. I think that's incredible. And now that changes today. I get it, but but it's an opportunity for partnership. And look, we've talked a lot about law enforcement. We've talked a lot about education. We've talked a lot about healthcare. And what you do is you blend two of the three, which solidify our community, and it keeps people in Montgomery. I could share 10 stories like Doug mentioned, where a family with a young special needs child, they are forced to make the decision typically to move to Birmingham. And we can't offer education, we can't offer health care. This doesn't even begin to scratch the surface of mental health care services, which you talked about today, and veterans health care services. So you're hitting it out of the park in so many ways. And we won't continue to talk today, but I know that we will continue to talk. I know that we will continue to see how we can support your efforts in whatever way that may be, because you're supporting Montgomery County, and we appreciate you.
Thank you so much, Commissioner Costanza. And I want to invite the commission, all of you, to come to our campus and have a commission meeting. I understand that.
We did that before.
You did that before, and might have been before the pandemic happened. We'd love for you to come, see our facilities, and meet some of our other folks as well. And if we can partner together in the future, it's good to know what you can see. If please come, if for no other reason than to see what $19 million can do to a Burlington coat factory. We're very happy. Generous donors helped with that. That was not a public dollar in that facility at all. That was all private dollars, and we're committed to this community. Thank you so much. Any other questions?
Mitch, thank you again for y'all being here, and it's so exciting, because it's just something, it's probably one of the biggest voids. You're filling that here we have in Montgomery County, is the special needs programs and opportunities for our special needs families. So thank y'all so much.
Thank you,
And we'll
Brother
be in
Doug.
touch.
Yes,
Just
sir.
a public
Thank you.
statement. I want to thank
Yes,
you all
sir.
for allowing our children to come through to the facility to play with the anatomage tables with our gut check program.
Yes.
Thank you, Dr. Boyd. We're hoping to get another segment this summer. Can you say yes to that? Thank you.
And Mitch, this is all
sir.
open to the public for special needs.
Yes.
Like the Boundless Playground.
That's correct.
Okay,
That's correct.
Yeah.
That's correct.
thank you.
Thank you
Thank
so
you.
much, folks. Look for your invitations to the grand opening for the Veterans Clinic. They'll come to you very
We'll
soon.
be there.
All right, thank you.
Thank you. Mr. Chairman, that concludes the items for our information session.
Yeah, just to update, we had scheduled a meeting. I'd asked to have a meeting with Dr. Byrd from MPS and Dr. Langford from Pike Road Schools. The meeting was scheduled for last Tuesday. Dr. Byrd had to cancel the night before and could not reschedule last week, so just give you an update on where we are with that. MPS has asked for stable funding. The board chairman asked for stable funding. The superintendent asked for stable funding. The running ads for stable funding. So hopefully in the near future, we'll be able to fulfill that request of them to have stable funding going forward. So real quick, Clint Graves is here. Clint, just a couple of minutes. You want to share with us what tax-free bonds are, so as we're looking at funding and how to fund some of these obligations we have going forward?
Yes, sir. So we've prepared a resolution. There's certain capital improvements and equipment acquisitions that have been approved or could potentially be coming up for the county. So what we've done is prepare a resolution that we call a reimbursement resolution or an official intent resolution. And what that does is it provides the flexibility to the county commission to reimburse itself for those capital improvement expenditures or equipment expenditures out of potential tax-exempt bond proceeds if the county eventually issues tax-exempt bonds. So the resolution that is before you, I'm not sure it's before you today, but it will be at a later agenda item. The resolution before you does not approve those expenditures. Some of them have already been approved. It does not approve the issuance of debt. All it does is authorize the county to reimburse itself out of eventual tax-exempt bond proceeds if the county does issue debt.
Yeah, just was trying to be proactive, looking forward.
That's right.
So that's all of it. So Clint, thank you for your work on that.
Thank
Clint,
you.
here's a sheet I meant to give to you. I tried, I couldn't find it yesterday, so. But that's all I have. Anybody else on the commission have anything? Dan, you have anything? If not, we will.
No.
Okay, we're.
No, I don't have anything.
9:55, we'll recess until 10 o'clock sharp.
All right.